Tell me about the conversation that you had with staff. What did they tell you?
They got the call from the administrator on call that night that there was a fire in the area, and that it was very close to the hospital, and that they were concerned about the condition of the surrounding area, and that there might be a situation where they might receive patients from other facilities, and that they were actually the receiving center for families in the area that were being evacuated from their homes. So they decided to come in, and that was around 1 o'clock in the morning.
Things changed quite drastically after that.
Things changed within minutes. So the administrator on call came. At the same time, she called the chief nursing officer, and the chief nursing officer came in, and the two of them started making the phone calls for the rest of the administrative team, anyone that they could get to come in and help. And within minutes, they had made the decision, after they saw what the surrounding area was like while they were driving in, the glow on the hillside, the fact that they had to use their windshield wipers to clear the ash as they were driving on the freeway. I mean, the stories are unbelievable that they told, even trying to get to the hospital. So they got in, but then shortly after that, people that they were calling in couldn't get in.
So you're a lifelong nurse. Take us behind take us behind the scenes. What would it be like as a nurse to have to evacuate a hospital with 77 patients?
You prioritize who needs to go first, which they did. The first thing that they looked at were the NICU babies, and getting the NICU babies out of the hospital, which they did. They got the moms going as well, and the ICU patients. So NICU, moms, ICU patients, and then they triaged the med-surg patients. And they did it in a very organized fashion. They got everybody out safely. They got them to the surrounding hospitals, and they just did a magnificent job. There wasn't one single problem with the transfers of those patients. They got the records as much as they could to get those transfers done.
This was all happening while fires were burning.
They tried, their goal was not to look out of the window. And it was very interesting when they told that story. They needed to keep working, they needed to stay focused, and so they decided not to look out of the window, because if they looked out of the window, they might freak out with what they would see. And the staff was truly amazing. They focused on their patients, they focused on getting them moved. And at the same time, remember, they were getting the community people that they had congregated in their bistro out safely as well. They had community people, they had their animals. I mean, they had a menagerie in their bistro as well, and they were responsible for getting those people out safely. There was also an assisted living facility or board and care facility, and they had to get those patients moved to a neighboring skilled nursing facility. So there was tremendous triage and movement. They called in buses, they called in ambulances, and they got all of the patients and the community members moved.
And of course, they didn't know the status of their own homes, their own families.
These nurses and these engineers that were in the facility and the EVS workers that were here all have families and homes that they had to kind of put in the back of their minds as they moved the patients out safely. Nobody knew the status of their homes. There was terrible cell phone service, so they couldn't even make calls if they tried. And so they had no idea whatsoever what was going on in their own homes.
What would you like to tell your employees in your community?
I would just like to tell the employees that I am tremendously grateful for their dedication, for their sense of community, the way that they work together across the operating unit, and I'm in awe of their dedication. And I can't say enough about how much I appreciate what they do each and every day, and that I'm truly proud to say that I am one of them when I say that I'm a nurse.